Good day. Let's talk about what is a heart attack. This is an imbalance between the blood flow needed by your heart muscle and the actual blood flow that gets to your heart muscle. It's important to note that a heart attack indicates that the part of the heart muscle is dying. However, it's only in very bad cases does this lead to someone collapsing and dying suddenly. That can only happen if a lot of the heart is under stress and stops working or electrically misfires, which can lead to sudden collapse and death. If you've been told you've had a heart attack, the doctor has made this diagnosis based on your symptoms, based on your blood work, specifically a marker called troponin, and your EKG or electrical tracing of your heart. There are different types of heart attacks. STEMI is the most urgent type, where you will be taken to a cath lab right away to open up your blood vessels with a stent. If you are in a place where there is no cath lab, they might also give you IV medications to dissolve the clot. Based on the cath lab evaluation, if the blockages are too serious, you may be referred to a surgeon for a bypass surgery. A non-STEMI is another category of heart attacks that is less urgent than a STEMI but has the same pathway. A type 2 MI, which is a very common heart attack, is a supply-demand mismatch. So in times of stress, like if you have a pneumonia or you're sick from other causes, there might be a mismatch in the blood flow. This generally does not require urgent intervention, but it absolutely requires you to be on good medications to lower the risk of future events. Speaking of good medications for heart attacks, we generally put you on a combination of blood thinners, one of which is aspirin, and the other one is ticagrelor, clopidogrel, or prasugrel. We also put you on statins that can stabilize blockages and prevent them from getting worse and lower your cholesterol levels. We strongly consider using ACE or ARB inhibitors, especially if you have diabetes or low heart function. If you are not able to take statins, there are oral drugs like ezetimibe or bempedoic acid, and there are also injectable drugs like PCSK9 inhibitors that can help to lower your cholesterol levels. We really want to see your LDL or bad cholesterol level less than 55. But the lower that number, the better for your health. So in summary, heart attacks are of different types, and the evaluation really depends on what type you have. In some cases, you need to go urgently to the cardiac cath lab and may require surgery. Regardless of which kind of heart attack you have, it is very important to be on a good combination of medications to stabilize your heart and prevent future heart attacks. Thank you. This is Dr. Mehta.